Hi, my name is Elisa Gonzalez, and today I am here to talk about my contemporary health issue. I decided to do my research and talk about is the chronic kidney disease, and for short, the CKD. The reason I decided to talk about CKD is because I work in the vascular department, and throughout the years, I would notice more patients coming in to get a fistula, arteriovenous fistula. What that means is that there's a connection that's made between the artery and the vein for dialysis access, which we will talk about more about dialysis later in this video. But this year alone, we noticed that we had 500 new patients just in Orange County alone. Now, what is CKD? Well, it's a chronic condition in which a person's kidney function is reduced or damaged, which could be, damaged by a car accident or something happened that was not controlled by you, or it was just an accident. Moving along, the kidney's main task is to clean blood and filter waste out through urine. When the kidneys are functioning as they should, waste gradually builds up in a person's body, and this can have a devastating impact on their health. One thing that you notice about this is that these patients accumulate a lot of water and their stomach inflates. So that is one of the symptoms, as well as their skin turning yellow, their fatigue. Let's see here. Um, they have itchiness, swelling on the feet. You see a lot of swelling. Um, Daytime sleeping, joint pain, stiffness, loss of memory, not remember anything. So this condition is also called the kidney disease because of the loss of normal kidney function over time. It can also be called kidney failure, which is the end stage of kidney disease. Kidney disease is often associated with other chronic diseases such as diabetes and cardiovascular disease. People aged 75 years and over experience a high fetal burden of the chronic disease. There are quite a few things that can cause or put you at a higher risk for chronic diseases. That risk simply is higher if your family history of certain genetic conditions, such as polycystic kidney disease, autoimmune diseases like lupus or the LAG nephropathy. It defects in the kidney structure, can also cause kidneys to fail, and you have increased risk as you get older. Other common medical conditions cause kidney disease are the most common that we know is diabetes. Kidney disease could be both type 1 and 2 diabetes. Also, there is the heart disease and obesity that can contribute to the damage that causes the kidneys to fail. Uh, These are some things that are under our control that we can avoid kidney disease, such as heavy or long term use of certain medications that can cause kidney damage, even those medications that are over the counter. Smoking can also contribute to kidney disease. Often there are no outward signs in the earliest stages of CKD. um, CKD is grouped or are in stages between 1 and 5. The earliest stages are 1 to 3. As the kidney disease progresses, you may notice symptoms such as nausea, vomiting, muscle cramps, loss of appetite, the itchy, the trouble sleeping. All these here that we see on the screen are some of the examples that they have. Um, right now it's important that you get checked. Let's see here. Kidney disease has been a sharp increase in the past 27 years, and that many of these deaths were preventable. So, meaning that we have control of, obesity, we have control over our diabetes. So, we need to just change our lifestyle of eating. Obviously, we cannot change, you know, our how have that we could have diabetes because of our parents, but we could, if we know about it, then we could start with our diet and exercise and just change our lifestyle so we could prevent us from getting to this stage. Um, right now that I am at the age of 30, 38, I guess, um, because I have a family history of diabetes and hypertension, um, I don't have to, but it is recommended that you start checking your sugars every day to make sure where you're at so I don't fall into that diabetes and later on have kidney failure just because I couldn't change my diet with minimizing my starches, my sugars, bread, all that good stuff that I like. Can't say I can't have it, but I just need to minimize that and make sure that I have a routine checkups with my provider to make sure that we get my sugar or my A1C or my GFR, just check where I'm at this level. Moving on, there in the United States, there are 37 million adults um, that are estimated to have chronic disease, um, and most aren't aware of it. One out of three Americans adults are at risk for CKD. That's including again that because of the diabetes, the high blood pressure, the heart disease, the obesity, the family history, and also mostly being age 60 and older is where we see most of our patients here having the CKD. Um, it could be also because we are African American, Hispanic, Native American, Asian, Pacific Islander. They have an increased risk of developing the disease. Um, African Americans are more 3 times more likely to develop and the ESKD than the whites. Compared to non-Hispanics, the Hispanics are almost at 1 to 3 most likely to receive a diagnosis of kidney failure. So chronic disease is represents especially a large burden in the low and middle income countries, which are least equipped to deal with its consequences. Chronic kidney disease has emerged as one of the leading causes of mortality worldwide, and it's one small number of non communicable diseases that have shown an increase in associated deaths over the 2 decades. So, what that said is that within the years, we are seeing that, in these low middle countries, that we are not aware or we are the people here um don't make a big deal about it. Like a lot of people don't know they don't have it until it's too late. So some people don't like going to the doctors. We don't have good medical coverage, so it kind of makes it very difficult where to stand here. um Moving along, there is no cure for CKD, although, like I said, a lifestyle change can help and prevent the condition from getting worse. People later in the stages of the disease could either get a renal replacement or dialysis, or just get a transplant just to survive. So once you are diagnosed and you don't start taking care of yourself early stages, then your only option to live now will be through either getting a transplant or start dialysis. And so that's the only two things that you're able to do. So, you know, there's a lot going on. But even though if you get diagnosed with CKD, that doesn't mean that you can't do what you've done before. Learning that you have it and learning how to live with it, it can be challenging for some. But, once you accept it and you have knowledge of it, you'll be more comfortable. Obviously, there are choices that you just need to change now and a new lifestyle to go by. No smoking, no consuming alcohol. If you're overweight or obese, starting to lose weight, staying active. Obviously, you're going to be fatigued, you're going to be stressed, but talking to someone or, you know, most of my patients, when they go to dialysis, they meet a new group of friends, and you're there for hours. So now you kind of have a new family to be with around, and someone that understands you. So you're not alone in the world. Being sick with chronic disease or kidney disease um, has affected healthcare. Many of our patients are dying or do not get treated well because they don't have the right healthcare. Being on dialysis or having any treatment is very expensive. So, medication is expensive. So, you know, doctors need to be more firm with their patients' health, because diabetes is or obesity or anything that a patient has could, you know, it just needs to be changing by, telling them the honest truth, even though it hurts. Many patients are, they don't like straight to the point. They like everything sugar coated, but with this kind of stuff, it's very important that a patient has this type of information so they could know, and maybe it will change their lifestyle. But if there's no information provided, or, you talk to them through, and, especially in the Hispanic community, taking away their bread, taking away their tortillas or any of that, it's very hard for the Hispanic person to let go. But if you explain to them, like, instead of trying taking away from there, it's just like reducing it. Many people try to just remove it from their diet, and that's what, you can't do that, and they will always decline. You want to just have them say like small portions. Don't overdo it. Instead of having five tortillas, go down to two, or if not one, and, move it along. But, you know, CKD is one of the most expensive medical conditions that one could have. And, if you don't have good insurance, pretty much, you're not going to make it. Um, so a lot of studies have shown that, it will be better that that you are treated in the beginning, or try to not be in that stage, um, because it just gets more difficult after that. Um, so the CDC has stated that the kidney disease are leading cause of death in the United States. Um, a lot of people are undiagnosed. People, like, again, they don't have symptoms. They don't know they have it until it's too late, until they can deal with their body anymore. It's already come to the part that, your stomach is so tight and full of fluid that you need to get rid of it, or when you're coughing and you're gonna pass out, that they need to place a catheter so we could start doing dialysis. But those are just the things that people already end up at the doctor's office too late, instead of coming in regularly to make sure that, once your numbers start going down or going up, especially the A1C, that is an important blood work to know where you are, and start monitoring it and trying to control it, you know, starting at a young age, starting at 21, or, start going, especially if you have a family history. So, um, I believe we have here, that mostly, it affects everyone. It's not just one certain group. You have it all over the world. It's from 11 countries, more than 11 countries, but mostly you could do every country in the world. Everyone that is experiencing CKD, everyone's trying to figure out what can we do, how can we stop it, but it always has to start with, oneself and the knowledge, and making sure that we teach our kids the importance of health. you know I think if you start early and teach these kids, we can make sure that we have a better life. All right, thank you.